Guys, we're going to get started. I'm starting with this. This is kind of a basic integrative cancer therapy. And I think there's 400 slides on here, and there's no way I'm going to get through all this. But I start with this. I want to talk about some of the demographics. I want to explain to everybody here. I know it's unusual when you hear an oncologist say chemotherapy is not the all-in-all. But this is actually going to give us the data. Dr. Maharaj had alluded to the fact that we've increased cancer survival rates, but he said, but it's not clear if it's because we're just diagnosing early. Well, I'm here to show you that it is because we're just picking up diagnoses that may not be, in fact, cancer. We're going to talk about these things for the first hour, and then we'll get into more practical stuff. There is so much to learn in this fellowship, but I want you to understand that this is something that everybody can do, oncologist or not, and certainly I am not an oncologist. In the next hour, we're going to talk about when you have an oncologist who already has tissue sitting in a paraffin block, how can you can actually advise them and say, you know what, it looks like using this chemotherapy would be more effective based on the genetics of the cancer. We're going to talk about oncotype diagnosis, where we say, well, this patient has stage 2 breast cancer or stage 2 colon cancer. Do they automatically get chemotherapy? There are many doctors who just automatically do it. Many oncologists do it. And well, this will actually allow you to educate the oncologist and say, you know what? Based on these criteria, this person is not going to benefit from chemotherapy. So let's, having said all these things, and I will tell you, this is an exciting day. And Sean, do me a favor. This is embarrassing. I've got so much going on. But Dr. Gonzalez, what time is he speaking? 10. I'm as excited to hear Dr. Gonzalez speak. I'll let him tell. I won't steal his thunder. Dr. Gonzalez is not here yet in the room yet, is he? Okay. Because it's he's one of the guys who has been on the cutting edge and who has messed with the FDA, and this is going to be a very exciting day. So having said that, let me just start out with the Integrative Cancer Lecture. According to the American Cancer Society, cancer is a group of diseases characterized by uncontrolled growth and spread of abnormal cells. In the past 40 years, we have minimally extended survival for most solid tumors. Yet it's not uncommon for new drugs to reveal spectacular results by curing cancer in mice. So the question is, if we're curing all this cancer in mice and it's not translating to humans, the question is, are our models through which we research cancer in the laboratory valid? And I'm here to tell you that we need to completely reform our system. And I know you all know that we've got such serious problems, not just government and social and medicine, it goes on and on and on, but clearly our cancer research, our whole paradigm, if we have not improved advanced stage cancer survival, and I'm going to show you we haven't, we've got to change the paradigm. So I'm just going to tell you quickly, the common ways to do mouse studies are you take human tumor xenografts, you'll inject some cancer cells that have been sitting around for years and years and years and mutated so many times, we don't even know by the time we inject it in the mouse, is it even what we started with 5-6 years ago? Well, then we try to do a little better. We're often using transgenic mice where we'll inject a gene in them that typically makes them immunodeficient, more susceptible to cancers. Is that really replicating what goes on in the human body? Absolutely not. Something that's better but more painstaking is orthotopic transplants, where you'll actually you can take tumor from the individual. Let's say someone has pancreatic cancer. You actually take that pancreatic cancer tissue and inject it into the pancreas of a mouse. That's closer, but what I'm going to tell you is that's not studying cancer either. So I really believe that our models are not good. Now, one of the things that I always talk about is the basic premise or definition of cancer by the American Cancer Society is incorrect. According to the American Cancer Society, cancer is a group of diseases characterized by uncontrolled growth and spread of abnormal cells. That's an incomplete definition. The correct definition is cancer is the interaction between the abnormal cells and its natural environment. I need to add the word natural. That results in uncontrolled cellular growth. Okay, so there's a communication, and I think Dr. Maharaj alluded to some of that. There's a communication between the abnormal cells and its natural environment, which we'll get into. So when you take these abnormal cells and you inject them into a new environment, well, that's not cancer anymore. You've broken up that pairing. That's not cancer. It's very similar to saying, I'm going to do an allogeneic stem cell transplant. You're giving a new environment. When you do an allogeneic stem cell transplant, you use myeloablative chemotherapy, you wipe out the bone marrow, and you put a new immune system in there. And if the patient doesn't die from graft versus host disease, you have a cure. Does everybody follow me on that? Now, we're talking about taking cancer out of a person's environment and injecting it in a mouse and saying, oh, it's cancer. And we're expecting to see the same results when we test our chemotherapy drugs on the mice. We expect to say, oh, okay, this looks real good, and it should translate into humans. And you know, when it works, we do. We see a 2 to 3 month increase in survival. That's not the answer. So we spent most of our time and money attacking cancer cells while ignoring the environment which communicates and governs the actions of these abnormal cells. So Dr. Maharaj's work is into treating the environment. And that technique that was developed by the doctor he's working with, Dr. Cooey from Wake Forest University, is called leukocyte infusion therapy. And what they do is they're putting white blood cells that have shown to be completely resistant to cancer into another individual. So they're affecting the environment. They're not even trying to treat, they're not attacking the cancer cells. They're affecting the environment. So I'm here to tell you that any therapy that is only targeted at treating the cancer cells is spitting in the wind. So what is the cancer environment? Well, the bone marrow, the innate immune system, and the acquired immune system. You know, when I was going through medical school, I think most of the teachings were that the acquired immune system plays the major role in killing cancer, and now we've really reversed that. And we see the innate immune system is very important. And certainly Dr. Cooey from Wake Forest University has some wonderful, wonderful images of showing the granulocytes and the macrophages encircling the cancer cells and lysing them. So the innate immune system is very important and is part of the cancer environment. The neutrophils and the macrophages. The macrophages will be signaled and literally work with the cancer cells or can work against them. Dendritic cells, antigen-presenting cells, of course, and the natural killer cells. And then, but not to downplay, the acquired immune system is important as well, of course, and those are the T lymphocytes and B lymphocytes. But as Dr. Cooey showed, the most important elements in attacking the cancer from an immunotherapy standpoint were the neutrophils and macrophages. Well, what's also part of the environment are the endothelial progenitor cells. What literally happens, one of the things we've talked about in other modules is I always say a well-oxygenated tumor is a happy tumor. And of course, this is other lectures and other modules, but I like my patients' tumors to be well-oxygenated. And most of the oncologists will say, no, you're going to feed the tumor. We want to give Avastin and deoxygenate them. Well, Avastin can work very well for a while. And then it can, in the long run, breed a very resistant cancer. Well, what happens is when the cancer is poorly oxygenated, it starts signaling. Okay, it's very hypoxic, and it's not just oxygen that they're not getting, but it's nutrients. And the cancer is to survive. So then it signals the endothelial progenitor cells in the bone marrow and tells it to set up shop somewhere else. And so that is the way neoangiogenesis begins. Platelets. Platelets are important as well. There's a site called the P-selectin site on the platelets, and literally the tumor cells will bind to that and take trips around and end up setting up shop somewhere else. The extracellular environment is important. The extracellular milieu, and we'll talk a little bit later on when I give my update on the treatment that I'm doing. The extracellular milieu outside the cancer cells is very acidic. And what we've seen is that the acidic environment promotes the release of growth factors. It promotes the release of matrix metalloproteinase to break down your own tissue so the cancer cells can dig in. It promotes the release of factors that promote angiogenesis. And so we'll talk more about that in future modules and show that if you alter the extracellular environment, if you alter the pH outside the cancer cells, you can affect metastasis. And then, of course, there's the energy supply. Is this a cancer that's primarily feeding on fatty acids? Is this primarily feeding on glucose through glycolysis anaerobically? Is this primarily, is it low S standard uptake value on PET scan and primarily using mitochondrial oxidative phosphorylation? You need to know your cancer. If you're going to treat the cancer and you want to affect its energy supply, if you want to affect its extracellular environment, well, you have to know what it's feeding on. The easiest way for me to do it, is I get a PET scan. And if the PET scan shows it's lighting up big time, well, it's probably a very glycolytic cancer. So once again, you've got to treat the environment. I'm not saying don't attack the cancer cells, but I am saying if you attack the cancer cells and ignore the environment, it's a lose-lose situation.